Viagra and Cialis are often the first thing that comes to our mind when treating sexual dysfunction. However, we have many different therapies that are available to help with sexual performance. And today, I want to go ahead and break them down and compare the differences between them. Yes, we have the popular medications that are phosphodiesterase inhibitors like Cialis and Viagra. Testosterone replacement therapy and optimizing hormones. We have peptides like PT141. And I've also listed 2 bonus therapies, so make sure that you stick around towards the end of the video. Now, a brief overview. I tell a joke to my guys who are struggling with sexual dysfunction. You're walking in the woods and you see a bear. Now, unless you're attracted to bears, it's not a great time to get aroused. It's time to run. And our sympathetic nervous system kicks on, and that shrinks the blood vessels to our sexual organs and opens them up so we can fight or flight. Now, this is a neurological reason for people who suffer with sexual dysfunction is that they're in a constant state of stress. On the opposite end, we have our parasympathetic nervous system, the rest and digest, or the read and breed side of our nervous system. So we should keep this in mind as we talk about our therapies today. So first, let's talk about our phosphodiesterase inhibitors. The popular drug name is Cialis. Its generic is tadalafil. And our other popular drug is Viagra. Its generic name is sildenafil. Inside of our body, there's something called phosphodiesterase. And what that enzyme does is basically shrink our blood vessels. So these medications block that. And then in turn, our blood vessels open up and they stay dilated, therefore giving us more blood flow, in particular to our sexual organs. Our sexual organs are very sensitive to blood flow and they're needed for optimal performance. And often if you're stressed, that shrinks our blood vessels. And also if you have cardiovascular disease, that damages our blood vessels and impairs its ability to open up. That's why often taking one of these phosphodiesterase inhibitors 20 to 30 minutes before can be a very quick fix for helping with sexual dysfunction. I personally prefer using tadalafil. It's not as potent as sildenafil, but it has a much longer half-life. Because it has a longer half-life, it's not as particular about the timing that you take it. It can be used upwards to a day. Sometimes it can even last for 2 days. Sildenafil, on the other hand, needs to be used in 4 to 6 hours. Now, with that being said, sildenafil is more potent. And if you're having more severe sexual dysfunction, is often superior to tadalafil. The only issue is if it's more superior, it's more likely to give side effects. Popular side effects with the phosphodiesterase inhibitors are acid reflux, headaches, stuffy nose, and it can even drop your blood pressure. So while these may help with blood flow, they can leave you with other side effects, which can also impair your sexual function. That being said, this is often the first therapy given to people who are struggling with sexual dysfunction. Now, another therapy we need to talk about is optimizing your hormones. If you've been around my channel for a while, you know this is an area that I focus on because I see so many of the benefits that come from it. Many men suffer from sexual dysfunction due to low testosterone. Low testosterone impairs our cardiometabolic health and destroys our blood vessels. Having optimal testosterone increases our insulin sensitivity and improves nitric oxide production, and thus so increasing our blood flow more naturally. Now, it's not always easy to get your hormones optimized, so sometimes guys do have to turn to testosterone replacement therapy. With that being said, if someone's struggling with sexual dysfunction, you really need to check your hormones, and in particular, testosterone and free testosterone. And sometimes testosterone replacement therapy can do the trick. Often when guys get on testosterone replacement therapy, they notice they have more energy, they have more drive, they have more motivation, and ultimately more libido. All these things then obviously help with their sexual performance. Now, with testosterone replacement therapy, this can take a little bit longer. Whereas tadalafil could work the day that you take it, testosterone replacement therapy can often take weeks upwards to months. Also, testosterone replacement therapy has a plethora of other things that you need to be considerate of as far as side effects. So best to work with a qualified healthcare practitioner if you want to explore testosterone and testosterone replacement therapy. Now, another area that's becoming more and more popular are peptides, and in particular PT141, aka bremelanotide. This comes from a peptide called melanotan. And funny enough, melanotan makes you tan. We actually call melanotan the vacation hormone. It increases your libido, makes you tan, and can help with weight loss. Now, while those things are great and dandy, often people just want the increase in libido, and that's where PT141 comes in. PT141 comes from melanotan and isolates the factors that just increase our libido and sexual desire. Bremelanotide, I'd say, is another quote unquote quick fix. So often, if guys have tried something like tadalafil and they're still not getting the benefits that they were hoping, often PT141 can be the trick. The issue with PT141 is it's not FDA approved in men as a subcutaneous injection. On the other side, men often experience quite a bit of nausea whenever they take PT141, which can hinder sexual performance. Now, with that being said, the other thing you need to be mindful is there are some people who have experienced what's called a priapism. They've actually taken PT141 and had an erection for over an hour. So you definitely want to be careful when you're experimenting with these peptides that you don't put yourself in danger. Be smart out there. Now, two other therapies that are growing in popularity are regenerative injections like platelet-rich plasma or stem cells, and also shockwave therapy. Platelet-rich plasma and stem cells, when injected into the penis, can help with regeneration, increase angiogenesis, which is the creation and promoting of new blood vessels, and it also increases collagen and nerve regeneration. Issue is not a lot of guys are interested in having injections in their penis. This too is often a weeks to month therapy. Very rarely do you get benefits after just an injection or two. Shockwave therapy is also becoming more and more popular. This is where you take an ultrasound-like device that has acoustic waves that, in theory, go in and blast up damaged blood vessels and encouraging regeneration. It stimulates microvascular repair and promotes the growth of new blood vessels. This, again, often takes at least 6 to 12 weeks to see some form of benefits and can sometimes take up to months. One of the arguments for both of these therapies is that you are also doing your best to get to the root cause of the issue. I would argue that these two therapies and testosterone replacement therapy are working at getting to the underlying issue. Tadalafil and PT141 may be looked at more like a Band-Aid. So in my clinical practice, how do I treat sexual dysfunction? Well, almost always I'm going to look at the diet and lifestyle and see things that could be impairing the nervous system and the blood flow. Cardiometabolic disease, overconsumption of stimulants. They may be even on some medications they're not aware of that can lead to sexual dysfunction. After that, I really like looking at blood work, and in particular, testosterone. Optimizing the testosterone, whether through natural and holistic methods, optimizing the testosterone, whether that's through diet, lifestyle, or medication. And younger guys often will do the trick. I often will talk about tadalafil when starting testosterone replacement therapy, as I believe tadalafil has a plethora of other benefits aside from sexual performance that can be beneficial for most men. So I usually start with those two therapies. PT141 can be considered, and at that point too, I'll walk them through shockwave and also regenerative injections and figure out which route is best for the patient. So there you have it. We have 5 major ways that can help improve sexual performance. One are the phosphodiesterase inhibitors like tadalafil, hormone optimization through testosterone replacement therapy, peptides like PT141, regenerative injections like stem cells and PRP, and shockwave therapy. If there's something that I left off the list, go ahead and leave them below. And if you found this topic interesting, I think you'd like this other video that I did. Thanks for stopping by. Until next time, stay vigilant, my friends, and God bless.